What's going on, folks? Your boy again, Dr. Sean Thomas, back in the building, episode 73 of the Be More Today show. We are back in the building, and folks, 73 episodes. We're here. We're doing this thing. It is the end of summer. Labor Day is past us. School is now upon us, and the Be More Today show still continues to go on and push forward. We are still here, trending now in 39 countries. So thank you so much for your love and your support. Really appreciate it. It's been as I always say, labor of love. But I've learned so much from my guests on these shows. The More Today show is continuing to focus on health and wellness, and we're now heard in 39 countries and trending, like I said. And again, we're found everywhere. BeMoreToday.com has my book, our music information, our podcast information on there. Our YouTube is booming now with workouts, and we have our Facebook page. If you guys are not on our Facebook page, we have our page on there. We also have a Be More Today PT group that I started, where we're just putting out content about physical therapy, health and wellness, holistic living. Join our group on there and just be inspired daily, if not weekly, about things that we're putting out there to make sure that you can be more today. And if you want to support us in any way, just please go on our page and subscribe, like us. We appreciate all the love and support that you guys give. My quote for today is simple as always, and it is by Eddie Hippolyte. And he said, "We are limitless in how deep we can dig to find strength, but sometimes limited by how shallow a crisis can make us feel. Dig deeper." Last week, folks, we had a hurricane, and it's funny, we just had, my wife and I had our 10-year anniversary for our marriage, and it was 10 years ago that a hurricane hit New York, and last week another hurricane hit. And it wasn't just New York, clearly, the whole East Coast was hit, but so much stuff happened. And, if you were in a place that was safe, you had no idea. You didn't realize how intense it was. All you saw was a lot of rain, a lot of flooding, or just a lot of rain, right? Depending on where you were. But there was so much damage that happened, so much destruction. People died, and it was just tragic the way that water, which is so frivolous and so easy and so light in certain situations, can be so rough and so destructive and so crazy to handle sometimes. And the crisis happened that night, where people basically went through a long period of trauma. Houses destroyed, cars destroyed, people floating on their cars and literally just trying to get from place to place. I heard a story of a family who literally the father and son went outside to go move the car. And while they were moving the car, the mother and other child were flooded in their basement, literally in seconds. So, not just being appreciative for life, because we do appreciate life and we should always, but these things come and they can change our lives forever. But it is in these times where we have to just be limitless in how deep we can find strength. And finding that strength to push forward, to move through the crisis, to continue to find hope, and continue to find ways to make sure that we cherish life for what it is. That's what it's all about. And my guest for today is the embodiment of that. She is someone who I met through my mother, who I appreciate. Mom, shout out to you for bringing us together. Her name is Carolyn McLauren. And Carolyn McLauren is a licensed clinical speech language pathologist. She's been educated for 14 years. She's also the founder and owner of Speaking of Therapy Consultant. She is a CPSE education administrator for the NYC DOE. She is a wife and mother of 2 children, Karen and Christopher, and she is a 2-time breast cancer survivor. And she's also a health and wellness entrepreneur. So, folks, Power Pack show today. Please welcome to the stage, ladies and gentlemen, boys and girls, pets included. My guest for episode 73, Be More Today show, Carolyn McLauren. Carolyn, what is going on?
Things are well. We're living in some crazy times, and oftentimes we feel like we are just spinning from one day to the next, not in control of much, but I every day remind myself that I am at least in control of my actions and the decisions that I make. And that keeps me grounded and able to push through whatever challenges come up on a day-to-day basis. So, yes.
Yeah.
That's me right now.
That's how it should be, and that's fantastic. Listen, my mom said you guys work together, and she said, "Look, you have to have this person on your show. Her story is amazing." So I said, "Let's make that happen." And you and I seem like we live similar lifestyles in the sense that we are on the go people. And I'm only saying that based on your schedule that you share with me via message that I heard. And I live kind of the same life where there's a window of time where you can find me, and after that window kind of goes by, I'm moving, I'm doing things, I'm living life, I'm working out, and if you want to catch me, you catch me between these two times. So I like that about you already because it makes me know that you are someone who, as I always say, is always on the move and appreciating life for whatever it's going to give you. And I'm just happy that you made time today to talk to me on the Be More Today show.
Yeah, absolutely. I mean, I met your mom almost a decade ago. We were working together in the same location. We have similar backgrounds and we clicked right away. But, after a while, we didn't, she moved on to another location and so did I. So we only maintain contact through social media, like
Mm.
most people these days. But yeah, I had no idea, how you have a friends list and you don't really pay attention anymore to who's on the friends list. Like you could totally forget until like one day she reached out to me. She was like, wow, I'm so inspired by your, transformation and your journey and all the changes. And she's like, that's just amazing. I have to talk to you. And, we snuck in a little conversation. It was brief. Like maybe 5 or 10 minutes. And then, she connected me to you. So that's an awesome thing.
Awesome. Well, let's get into it. Listen, I know that you are a speech language pathologist, and PT and speech pathology has for a long time been connected in terms of helping people get better and enhancing their lives. But you do have this business, and you were the founder and owner of Speaking of Therapy. What is Speaking of Therapy?
Wow. So, Speaking of Therapy is a company or a concept that I, came up with in my mind to kind of help parents navigate the, related service world and all the things that come with that. It didn't quite shape into that because what ended up happening was I started working in adult rehab and, hospitals doing per diem work on the side. And then I started getting these contracts from these rehab places for spillage or overage when they don't have providers for these patients that are really fragile and cannot come out to, appointments for services. So I started doing that. And that was maybe a good 6, 7 years ago. And it's really good. It's just that, like I said, I'm like the one person that's doing it all. And it gets to be hectic sometimes, but I love my job. And, as far as therapy, I really focus on like feeding and swallowing disorders. A lot of therapists may do language and all the other stuff. And I do some of that too. But my main focus is to improve the quality of life of my patients. So eating is a big social thing. And when you cannot eat and communicate with your family, it just puts you off to the side in a box. And I want to get my patients out that box to the best of their abilities.
Yeah. That's fantastic. I know that we learned a little bit about language disorders and things like dysphagia, and those kind of things when it comes to pathologies that involve the ear, nose, and throat. But there's such a very succinct study of how pathology like that really affect us when it comes to eating and swallowing, and how not being able to do that can really be a life-shifting event for children and even for adults. So I'm very curious. It's a very specific profession that you've gotten into, and I have a couple of friends who are in speech and language pathology. How did you even get into it in the first place? What drove you to gravitated you towards this profession?
Education wise?
Yeah.
Wow. Okay. So you would need to at least have a bachelor's degree in communication sciences, right? And disorders. Then you have to do your master's in speech, which is in this additional 2 years. which also includes a clinical practicum. So you literally need to work in different settings, hospital, school, whatever, clinics, just to get a wide experience on the different types of syndromes, disabilities, whatever people may have. And after that, you have to sit for a very grueling exam to become licensed by the state, whatever state you live in. Yeah, and from there, it's continuous learning the entire time because, yeah, you studied, you graduated, you passed the praxis exam, but it doesn't mean that you feel confident, proficient in all the different areas that, you can go into when it comes to speech. So you sort of kind of go with whatever you feel most comfortable with. At least I felt comfortable right away with feeding and swallowing because my daughter had feeding and swallowing issues. So I've been around it practically her entire life. And so I've seen it. I worked closely with ENTs and, different disciplines. And so I'm very comfortable in that arena. A lot of people don't like it because, you're dealing with people's mouths and body fluids. And it's like, I don't know if I could do it. And in all honesty, their lives are really in your hands because if they, God forbid, choke or something happens, they aspirate or anything like that, like someone could die if you're not really careful and knowledgeable of what you're doing. So yeah, it's really interesting. And the field itself is so flexible. If you get bored in one area, you literally could go into another area. You can work in a school, you can work anywhere, you can work for yourself. So I know that I won't be bored because I tend to get bored quickly, but I will never be bored in this field.
That's fantastic. Now, most professions during this time, within the last 18 months, have had to pivot to some extent with COVID-19, quarantine. And I know, especially for professions that involve anything involving bodily fluids, especially that involve the mouth, right? Because that, for the longest time, with COVID-19 was the biggest scare of how this thing was transmitted. How has the profession and even what you do individually had to pivot or shift during this quarantine session in terms of how you treat people, how patients are being treated, how children are being treated? Was there any lag in terms of not providing services during that time, or was there a seamless transition of adapting or pivoting so that services were still provided for most patients?
Well, I can say that all the PPE you can find, I mean, you just, don yourself from head to toe and you go in and do what you do. Yes, there was anxiety on my part because it's like, wow, there's something flying around out there and you don't really know a lot about it. You just know what you hear on the news. And it's like, you start to educate yourself. You do your own research and really and truly you cover up. They were saying this mask works better, this mask, and it's like, listen, all you have to really do is cover your eyes, cover your nose and your mouth, wear gloves, wash your hands frequently, and you should be fine. I didn't treat my patients any differently. For a while, like between March and I say May, I did a lot of teletherapy. So I was online mostly, and that's kind of difficult for the population that I work with because it really requires another person to facilitate the sessions. So if they didn't have someone to do that, then yes, they did miss services. And then one day I just said, you know what? I'm going back into homes. I'm gonna just brave it and go in. And it hasn't been horrible. I mean, I can't say I've had any bad experiences with, my patients or their families. Everyone communicates. It's like, if you're not feeling well, even if you feel a tickle in your throat, please let me know.
Mm-hmm.
And, we can always reschedule, put your health first. That's what I say.
Yeah, no, that sounds good. I have a couple of friends who, again, are in the same area, and they did the same thing. And some of my dental friends also, who clearly are in that environment where you're literally in someone's mouth the entire time, right? They had to really pivot themselves and say, you know what, let's just make sure we protect ourselves, and life goes on. We found
Yeah.
ways to pivot in this crisis and to make sure that we are still continuing to provide good healthcare, provide good services to our people when they need it. And I think that's the beauty of humanity. Every time there's an issue or a crisis, we respond to it, we pivot, and we keep moving forward. And I think that we've done a great job of doing that as healthcare providers and as humans in this crazy race right now. So I wanted to talk a little bit now about the CPSE. And I want you to explain, if you can, just to listeners, what that even stands for and what your newly acquired position is as an education administrator for that.
Okay, so the term, well, the acronym is CPSE, is Committee on Preschool Special Education. And like I shared before, I'm a new CPSE administrator for the Department of Ed. I've been in education for now 14 years, and I've gone from being a special ed teacher where I started to being a speech language pathologist within the DOE, and now transitioning into administration. So the role itself is I'm basically the first face of the DOE that families meet when it comes to providing or trying to acquire services for their child, their preschool child, 3 to 5 years old. So with that experience, it's like, I've been that parent. I have, like I said, 2 children with special needs, and I've been on the parent side of the table. And I use that to kind of navigate my meetings a lot, because I understand that parents come into the meeting and they see the DOE as the big bad wolf. And, it's just, oh, it's them against me. And I just want my kid to get help. And honestly, we all want your child to get help. That's why we're at this table. And if you get your parents to be comfortable, which I like to do, and get them talking about their child. You get so much information that even the parents don't even realize, by sharing this information, they're really advocating for their kid. And that helps me make a better recommendation as far as placement and types of services that that child will benefit from. Keep in mind, I also have to look at, different evaluations from different disciplines, whether it's PT, OT, psychology, speech. So I'm reading all these evaluations, and I really have to add what the parent says and come up with, a recommendation that's going to be suitable for the child to have proper foundation going into school, if that makes sense.
Yeah.
It's really like a process that happens very quickly, but a lot of times parents come into the meeting feeling like they don't have the expertise, if you will, because they're hearing all this lingo at the table, which I try not to do. And if I have to, I really make sure I define it for them and make sure they have their questions answered. Because when you don't know something and people are just talking, it feels like they're talking over you. You tend to get really small at the table. And the reason why we're here, we're talking about your child, and you want the best for your child. We want the best for your child. But to be in this position, it really means teasing out the information from the parents, information that they don't even think is relevant. Like, your child's temperament. What do they do when they're upset? How long does it take them to calm down? Little questions. And, that gives me a very, very big picture on it, to what placement would this child do? How would they, react in a classroom, or if they don't get their way, or what kind of supports do they need? Do they need a one-to-one para to help them throughout the day while they're in a general education classroom? Because the push right now, and parents should know, is for the child to be educated in the least restrictive environment, meaning with their peers, same age peers in a general ed classroom. That's always the default, right? But then we have to factor in all the other things about that child that makes them what their individual needs are. That's where it gets a little, gray. And then we have to start to figure out what supports they need that will allow them to participate in a general education classroom with their peers. Because once you start separating kids, they don't learn the same. They don't, and they never catch up. And I know that from being a speech therapist in the DOE before doing this. Kids are coming in and they still have the same services they had when they were in elementary school. I'm like, well, why is this happening? Why are they not being more towards generalizing their skills, and why are services still the same and not being reduced? Because at some point you were in therapy. If you're benefiting from therapy, you shouldn't be needing that much support when you get to high school or even middle school. But, it's just a system thing. And we have to kind of really look at these kids as to what's going on with them every year, what's happening, why they're not moving. Is this program, is this placement right for them? Maybe we should revisit the whole thing. But a lot of times that's not happening. We're just in this shuffle of moving kids along.
Yeah.
And, as an educator and a parent, that cannot be, because we're really doing a disservice if we do that.
I've had a couple of different people who are parents of kids who have special needs, and the I think the struggle that a lot of people don't realize is that it's a ongoing, ever-changing experience where uh, you're fighting for your child to have the best services all the time. You're fighting for your child to have the best situations all the time, whether it's school, whether it's medical services, whatever the case may be. And there's so much knowledge that is not always shared, but there are resources like you're sharing with yours and a couple others. We had some people on the show who also had resources where they're giving parents the opportunity to learn more about what's actually out there, how they can benefit, how their kids can benefit, to make parents' lives a lot easier. Um, I have a daughter. She's 6, so she's going into first grade this year. Actually, next week. She's super excited. But I remember just applying for preschools in general, in kindergarten in general, and just that process by itself, especially in New York City, that by itself is draining. So when you add on top of that the special needs component and all the things that come with that, along with just regular school in New York City, it can be daunting.
Oh,
It can be
I
super
know.
daunting. So, I appreciate the work that you're doing, and you just being able to really calm parents down and escort them into the school system
Right.
with one less thing or two less things to worry about. Um, and as schools opening up now and starting, are there any tips or things you want to share with parents as we are about to start school that they should expect going into school this year? Any changes that are happening for kids in this age bracket?
I'm gonna say this: be flexible. If you know what that is, and if you don't know, try to every day be a little bit more flexible with everything, because change is ever coming with this. No one knows really. I mean, what's gonna happen? The school system, they make a plan, but a plan is only as good as the pieces that help to orchestrate it. And people are just, everyone is in this place of, I don't know, I don't know, I don't know. So, I'm sending my kid back, after being home for a year. He's 17, going into his senior year of high school. And just like, well, we're going to go in, you're going to want to make sure your kid knows how to wear a mask and that they keep it on. That's something we should be well versed in. We've been doing it for a year, but there are a lot of kids who, for whatever reason, medically wise, they can't sustain wearing a mask all day, but there are contingencies for that. Just be flexible, because your kid could be in school for a whole week, and then at the end of that week you hear, oh, they can't come next week because their classroom was shut down. So now it's like, oh, my kid is going to be home, but I have to go to work. Literally have some kind of backup plan as far as childcare, because that's where it gets a little frustrating for parents. And when last minute problems pop up, people get anxious, they get reactionary, they get angry, they get emotional, and it's not going to be good for the child or for the parent at this point. So if you have a backup plan, I would say have two for childcare. You should be okay. Remind your child, wash their hands, keep the mask on, and I think just take it one day at a time, because every day brings something different.
Yeah. I have a question for you. I have a lot of friends who do various professions, right? And they get into careers, and sometimes it's based on their own personal preference, and sometimes it's based on their experiences. For instance, I have a friend of mine who does a program now, or actually started a program for kids who have special needs because she is a parent of someone who has special needs. And I'm curious, in your situation, did you get involved in this because of your children, or was it something that you had already thought and had an interest in on your own?
Repeat that last part. I didn't hear it.
So a lot of people, like I said, usually get involved in situations when it comes to jobs because either they have a personal preference for liking that situation or liking that environment or that field, or they go through an experience where either someone in their life is affected by something that they're actually learning and they want to get into it. I have a friend of mine who runs a special needs program for parents, and she only does that now because she has a special needs child. So I was curious if you got into um, doing more of these things because of your children, or was it something that you had already had interest in even before they were born?
Well, I'm going to say this. Before my daughter was born, I had no interest I wanted to be a lawyer. I'm going to just say that straight out. I wanted to be a lawyer. I was pretty much on the lawyer track. And then, she was born and I was just fascinated by like, the therapists that would come in and I'm like, wow, I didn't even know this field existed. Like it was like a whole new world to me. And I would really, participate in the sessions. I'm like, I really like this. I really like this. And then what really sealed the deal for me between like OT, PT, and speech was when I saw African American speech language pathologist in the ICU unit. And I was like, wait a minute, like what? I wanted to know so much more. I'm like, wait, I just thought that they like go in the home. She was like, oh no, a lot of us work in a clinical hospital setting. I was like, ooh, and it was just amazing. And I was like, oh, I need to do this. I need to do this. How do I do this? So that was the start of speech for me. Like I really wanted to do it. And then of course I got sidetracked. And that's an interesting story because while I started going to Adelphi for my undergrad in speech, after I was so fired up about it, when I graduated from Adelphi, and you need to have a master's if you're going to practice, legally in New York State and get your license. I applied to all these graduate programs for speech, and it was just like TikTok. Where's the acceptance letters? Like, where are these acceptance letters? And I'm waiting for them. And then New York City was advertising this like New York City teaching fellows. I was on a train. I was like, wow, that's interesting. I could get into the school system too. And I was like, well, you know what? I'm just going to apply. It was like the application deadline, it was the day of, I think it was like a March 30th or something. By midnight, you have to submit your application for New York City Teaching Fellows. And I just sat in the bed and I just typed my little letter. I was like, oh, well, I'm just waiting for acceptance letters. That's what I want to do for speech. But, I'm going to just apply to this too. And then I got accepted into the New York City Teaching Fellows, like out of like 7,000 people. I mean, I was one of 7,000 people that got accepted. And I was like, wow, what do I do? And they were like, you need to accept it, by this date. And I'm like, wow, but I'm still waiting for speech. And the day I accepted the New York City Teaching Fellows, the same day my master's program acceptance letter came in the mail. I was so upset. I was like, oh my God, now I want a detour and I got to be a teacher first. And that's exactly what happened. And you know what? No regrets. And in the beginning, I was like, this sucks. Like, okay, I'll be a special ed teacher, because my kids are going to be in a special ed program. That works. So I did it. And then, truth be told, I fell off. I'm like maybe 5 years later or 6 years later, I decided to go back for speech. And that was hard with 2 kids with special needs and juggling a lot of things, but I did it. And it's not an easy master's program, I have to say. It is not. I lost my mind several times doing it, but I made it through. And to be honest, special education really informs a lot of how I work with my students. So that makes me a phenomenal therapist because the two just like married. They just melded really well. And so there's no regrets with that at all. I don't know, maybe the divine, intervention, that's the plan for me, but it just worked out that way.
Yeah.
It really did.
Yeah. Well, hey, those things work out the way it's supposed to work out. So that's fantastic,
Yeah.
And I always say timing is everything because it really is. It really, really is. And I'm looking at your story now, and I'm recognizing that you're multifaceted in the sense that was a battle, or a battle you have to go through educationally, but you also had other battles. And you shared in your bio that you are a 2-time breast cancer survivor. So you didn't battle just once, you battled twice. Do you mind just sharing with listeners how you overcame and what did you have to change in terms of your health habits, knowing what you know as a clinician, but also knowing what you know as just a human being? What did you have to really change to make sure that you were able to get through this thing, not once, but twice?
To be honest, the first time I went through this, I was just going through a lot of personal stress, divorce, and a lot of changes in my life, personal life. And I really it wasn't as bad as the second time. Like, I found the lump, they took it out, I had surgery, it was ambulatory. I didn't really have to go through any like chemo or radiation. They were like, yeah, it was some kind of mass in the milk duct. They were like, yeah, it's rare, but we caught it very early, so you should be good to go. And I was like, all right, okay. That was scary. And then the second time around was just really, knocked me off my feet because it was so unexpected. We're talking, the first bout was in 2011, and this one happened in 2018. Now, what made this one very different was I was pregnant from October, I would say October 2018, October 2018, going into the spring of 2019. And literally, we had a stillbirth in April. And so this, to be diagnosed with cancer like 6 months later, was just like, what the hell is going on in this world? Like, first of all, I had no fight left. I was still trying to get over the first incident. And then it was just like, here we go. Like, what do we do? And this particular mass I found on my own. Like, I was literally just laying on the couch watching a movie, and I just literally went like this, and it felt like an apple. I didn't even know how I didn't know it was there. And I was like, oh, doctors always say I got fibrocystic breast. I'll be okay. I'm just gonna call and make an appointment. It's about that time to get checked out. Very casual, like nothing, I wasn't alarmed or anything. But after I did the exam, I went through like a mammography and the sonogram. I got a call like not even 4 days later. And they were like, we need to send you for further testing. And I was like, oh, okay. Did that. But that devastating phone call came. I was like, wait, is this surreal? Like, you know how you sit and you have the phone and it feels like the room just zoomed out and then zoomed back in? That's exactly the experience that I had. And, my husband and I looked at each other and we were like, I don't even know how I'm going to do this. And he was like, do it. I was like, I do not have the fight in me to do this. I was like, this is nuts. At that time, we didn't know what type of cancer it was until we went to an oncologist and then a breast specialist. And they were like, this is a very aggressive type of cancer. And for the world who needs to know what it is, it's a HER2 positive type of breast cancer. So there's basically an estrogen-based breast cancer. And the reason it came is because I was pregnant, right? So the pregnancy woke up the cancer that I had before. And I was just like, is that even possible? They were like, yeah, it's very possible, but you found it and, we can try to contain it and hope it didn't go any other place. And let me tell you, I think I've been poked and prodded. I've never been poked and prodded that much in my life, ever. I mean, I was just like, this is that. I was just like, do whatever. And we did it, 6 rounds of chemo, major reconstruction surgery. I was on the operating table for at least 12 hours. And I thought that surgery was going to take me out of here. So I went running around, put my fears in order. I mean, like things that you didn't think about before, like a crisis come up, like you literally, us as people got to do better with our stuff. Because I was like, wait a minute, I need to make sure this is the line. And my husband was like, I don't want to talk about that because you're going to be here. I was like, nope, we need to make sure this is, in place. And it was just very, very scary. But yes, I lost all my locks. I had locks down to my butt. I was bald-headed. I lost my eyelashes. I lost everything. It was just like, but none of that matters because hair grows back. And I am here to still tell the tale and, be an inspiration to others. But I did have to change my mindset. My mindset was the thing that I changed because honestly, I was always in a place of helping everybody and being there for everybody, being everything with my family, my kids. I'm the advocate, the coordinator, on top of that, I'm married. I have people who are constantly reaching out for information. I'm like the go-to person for everything. And then I had to take a stop and say, well, Carolyn, you can't be all things to all people and leave yourself in the dust, like literally running on fumes all the time. And the stress, the running on fumes, that was probably what took me to the place that I went where I didn't want to go again. And so I decided to be more present for myself mentally, being aware of when I'm doing too much or about to take on too much. I do it all the time. People like us that's just, and it's normal for us to run around and do that. So I stopped all that. I started meditating more. I started exercising. Even, when my doctor gave me the okay, he was like, don't do anything too strenuous. You just had big surgery. And I was like, okay. So I would take little walks. And believe me, that was painful because I was 215 pounds. And I didn't know when I got to 215 pounds, just packing it on between not being, being depressed, being home, it's just like, wow, and I had to change my mindset, change the way that I ate. Much of what I eat, I wasn't always, I was eating on the go a lot because I'm always on the go. So now I'm very, very mindful about what I put into my body. And it doesn't mean that you have to change your whole, like, go from, a eat meat eater to a vegan or a vegetarian. Like, a lot of people make drastic changes. I didn't do that. I still, eat pretty much the same. It's about my combination of foods and how much of it I eat and when I eat it. So I've been doing a lot of research with that. And my mom is a registered dietitian. So she's been helping me kind of figure out all the macros and all the micros and all that stuff. And I've been putting, things together. And besides exercising, I started experimenting with meal prepping, right? So right now I have 5 little clients, and it's like, people are really liking this, and people are like, can you, are you still doing that? I would like you. I'm like, I can't even take on anybody else because it's hard. I have to cook all all the food for myself, my family, and for 5 additional people every single week. And I do that on Sundays. So out of the whole breast cancer experience was, going to the gym. Now I work out 4 to 5 days a week. And that's like my commitment to myself. That does not get changed for anybody. Okay, today we do it. Today I just shifted things around, but like literally, that's a commitment to myself that I do not miss. It happens every single morning. I'll pop up at 4:30 in the morning. I'm in the gym by 5, without question. And then I go on with the rest of my day like everybody else. And it's like, why do you go to the gym so early? Well, but if you work the day that I do, the kind of day is 14 to 16 hours a day average. Going to the gym in the evening is not going to be as productive as it is in the morning. The workout is going to be just like, hey, okay, I'm done. I'm going home. It's not going to be effective. So I like to put myself first in the morning. And that's what I've been doing, putting myself first. So no husband, no kiddos, no job, nothing gets in the way of me going to the gym. That's my time, my quiet time. So yeah, that's pretty much it. Working out, eating, better. Yeah, just being mindful of when I'm taking on too much and learning to say no, because no was something I didn't know how to say. Just learning to say no to people, because people are always going to need something. But you have to say no sometimes.
Listen, we just did our last episode actually was on self-care. And I had a social worker talking about self-care and how we need to be a little more cognizant of caring for ourselves. And you can't pour from an empty cup was her biggest thing. And it's so true. It's these things you just mentioned, taking time to really put yourself first, no matter what's going on. Even though there are 1,000 people who are pulling at you and tugging at you and looking for information from you, there's no way you can be sufficient or efficient to cater to their needs unless you're really taking care of yourself first. And I salute you for really taking that time and using this experience to pivot your life and to take this thing so seriously when now health and wellness is your thing. It's a thing that you take almost like your last name. It's just like a part of you, or your first name. It's a part of you, right? That's not going anywhere. You're waking up no matter what's going on and you're getting that workout in. And I agree with you. People who try to do these things at the end of their day, especially if you have a day like you and I have in terms of just ongoing madness until the end of the day, it's so much better just to rock that thing out in the morning and get your body charged up, because if you can get that thing done in the morning, there's no challenge that you're going to see during the day that can trip you up. Because you've already gone through the madness in the morning. You've already put your body through a rigorous routine where you push yourself to the max before anything has already even started. So when stress comes, whatever else comes your way, you brush that thing off. You keep moving because you've already been through that thing at 4 o'clock, 5 o'clock in the morning off the bat. And, that's kind of how I live my life as well. And I do think that shutting everything else off to give yourself that personal quality time, that self-care, is still something that I'm working with. I'm working on. My job is rigorous in the sense that I work in a very high volume patient facility right now. So even though it is quality care, besides just me taking care of my patients and running the clinic and then running my staff and hiring and firing, whatever else, and payroll and
Mr.
whatever else, you
Octopus.
know, there's this whole platform we do here with Be More Today. So, and then family and wife and daughter, and, you know, it can just be that thing where if you don't put a pin somewhere or put a pause somewhere, you'll literally just go from one thing to the next without really stopping and checking in with yourself. So, you know,
Exactly.
I salute anyone who takes self-care that seriously and makes it really a part of their regular routine. And you've done that. And it makes sense given your story. It makes sense looking at the history of what you do professionally and what you've been through physically, that you are such a health buff, if I will say. And, you know, I'm looking at the way that you've been sharing your story with others. And I'm curious, you know, you mentioned that now you are a health and wellness entrepreneur.
Mhm.
Um, is that just related to the food prep, the meal prep you're doing now, or is that does it go greater than that? And if
No,
so,
it's
how
it's
so?
big. It's something separate and apart from that. So this is what so about a year and like maybe 4 months ago, a year and 4 months. I was, I was exercising like most people, been getting back on their little journey, but I hit a plateau. And for those who don't know what that means, like you've been working out, you're losing weight, and all of a sudden the scale won't move anymore. It doesn't matter what you do. Like the scale is just stuck there. And this is the part where people often just give up on their journey because they're like, it's not working, and then people quit when in actuality, you should keep pushing through and finding that thing that's going to get you out of that plateau.
Hmm.
So a school friend of mine, I went to middle school with her, and she was, online, and she's selling these products. And she was like, oh, you should try this. It's a detox tea, and then, it's multivitamins, and it can help you out and keep you healthier, and maybe, give you the energy to push yourself harder and working out. So I was like, okay, I'll try it. What else do I have to lose? I'm already exercising, right? So I tried these products, and I was just like, wow, in like 2 weeks, like the plateau was gone. Like I literally dropped 11 pounds, and I was like, 11 pounds? Like, how is that even possible? I was like, this is a gimmick. Like this weight is going to just like pop back on me with an additional 10 pounds. Cause that's usually what happens when people lose weight quickly. So I was at least that much weight too fast. And I was like, no, but it never happened. I literally had the energy to work out. And that's when I got into this routine. Like, oh, I could do this every day. And I was literally working out 5 or 6 days. Then I was just losing weight. And it was just coming off really nicely. And I was just like, wow, okay, so I got to get into this. Like people need to be on these multivitamins. Like, and so I was like, well, how do I get into this? And she signed me up, and I've been doing it ever since. I sell NutriBurst and detox teas, and I take the NutriBurst personally every day because look at the pandemic I'm living in. Most of us don't get any vitamins with the food that we eat, and most of us don't even take a multivitamin. So that was like the missing piece for me. And being that, I have my little cancer situation, of course, I went to my doctor. I was like, is it okay to take this? And I've been taking it, my blood work, everything has been stellar. He was like, yeah, whatever it is you're doing, keep doing that because you're doing great. Like my blood work is better than the average person. Like when I tell you everything is just green all the way across. And it wasn't like that before. I was anemic before. I don't know. I think these vitamins are like a miracle. And if you don't take any vitamins, you should get on some. And what I like about it is that it's liquid. And so it just goes into your bloodstream faster. Where you take pills, most of it doesn't even get digested anyway. So that's what I've been doing. And I use the products. I sell the products. I mean, I have regular customers that swear by this stuff just like I do. So it's a win-win, right? So they can speak to it, I can speak to it, and that's just what I've been doing. And then the meal prep stuff kind of came born out of that because if you're talking about like, wellness and health journey, you can't, the kitchen is like the biggest piece of the whole thing, right? So you can take supplements all you want, but if you don't exercise, you're not going to get the same results as someone else that's working out. And if you can work out and then still eat, burgers and French fries every day as your diet, it's just not going to be the same effect. So it's really a whole thing. Like your mind has to be there. You have to train the mind because the body goes wherever the mind goes. And you have to be very mentally strong. And then you have to be disciplined as far as like the food choices that you're making, right? And disciplined and dedicated to get that exercise in, whatever that is for you. Maybe you're not the person to be in the weight room and doing a lot of weights, but you gotta find some activity to do. That's what I tell everybody. Start where you at. You like to ride bikes, go bike riding. You like to walk, go walking. Do something, but just don't sit in front of the TV and pop pills and swear that you're gonna lose 100 pounds, because it's not going to happen. I don't know. I don't know anyone that's happened to, but unless you want to go get surgery, that's the only other option you have. But exercising, losing the weight on your own is more gratifying than just laying on a table and then going through all the pain and risking your life basically just to look like a cookie cutter, like every other person who did the surgery. So that's my thing with that.
Yeah, no, true story, true story, true story. Listen, these are all the things that Be More Today is really about. It's really about making sure that we educate people and showcase the things that we need to do to be better. And we've had, again, 72 people on this show who have shared what that phrase "Be More Today" means to them. But Carolyn, I'm going to ask you right now, as the 73rd guest on the Be More Today show, when you hear the phrase "Be More Today," what does that phrase mean directly to you?
Well, for me, that means putting in more effort today than you did yesterday. So just, trying to be a better version of yourself each and every day that you wake up and you get a breath. You're blessed enough to take a breath every day. Do something to be better than you were yesterday. That's how I look at it, right? Because that's what I aim to do every day. Like, if yesterday I can only do 40 push-ups, well, today I'm going to try for 45. It's just like whatever it is that you're doing, try to do it better than the day before.
Yeah, yeah, that's it. Listen, you've shared your story. We appreciate it. How can people reach out to you, connect with you, learn more about your products, any of those things, either on social media or otherwise?
Social media right now, my most active account would be my Instagram page. It's C_Mac, which is MAC225. And there you'll see, daily workout motivation. Sometimes I post my meals on there, but I have a whole meal prep page that you'll find it if you go to that page. It's yeah, because Facebook, I'm not really on there at that, but yeah. I can only manage one Instagram account effectively right now.
I hear that. And any final tips you want to share with the listeners regarding health and wellness, regarding information for parents, regarding advice for people who have been survivors of breast cancer? Because, it's funny, there's so many people who have had cancer that either share or don't share. And it's just the more people I talk to, the more people, yeah, I had cancer, I had this, I had that. I'm like, wow, it's so crazy. So, any advice you want to share with anyone involved in the realms of life that you talked about, either breast cancer related or parents of kids who are high needs, special needs, or people who are just trying to get more motivation just to go out there and work out. Any last tips you want to share with anyone listening right now?
I feel like I can give a little advice on each of those things. I mean, it's like, as far as the parent side, take a lot of deep breaths, take moments for yourself. It is overwhelming, but you cannot do it alone. So seek help, right? Resources, there's an abundance of resources out there, right? And seek it out. Don't be afraid to ask for help. Sometimes you feel like we're all alone in this, and you're not. There are other parents, parent-to-parent groups out there. I mean, that really are supporting. They're supporting each other. So look for some resources, and don't be afraid to ask for help. You're not alone. As far as breast cancer is concerned, a lot of my sisters of choice is what I like to call them, because we've had the same experience. Some of us, we're in that like victim place, like, oh, I have breast cancer, I can't do that because I have cancer. You got to get out of that mindset. You got to change your mindset, because there's so much more out there for you that you can do. And just because you experience that situation, there's power in sharing that story, and definitely empower yourself in the sense of like, taking small steps to change the way you're doing things or the way you've done things, right? So if you were living a certain way and it led to that road that experience that you had, you have to try to change at least one thing that you were doing. And that may lead to multiple changes after that. But don't ever just be stuck with, oh, I had cancer, I can't do that. Or I don't know if that's for me because I had this situation. Whenever you're not sure, ask your doctor. But honestly, your doctor is always going to tell you, get moving. That's the number one thing. A doctor is going to tell you, get moving, walk. Walking is an underrated exercise. It works every single you're a PT, it works every muscle of your body. So I mean, start somewhere and get active in your life and think positively, because the mindset is like your brain is the most powerful thing for your whole body, right? It really dictates the trajectory of your life and the way your day goes. So you really need to take some time and get counseling if you need. Don't be afraid. I don't know why we're so afraid to talk to professionals, mental health professionals. This is so big. Because after going through such a dramatic experience, you're going to need someone that's professional to sit down and kind of like help you put things in perspective so you can move on with your life and be empowered by the experience and not be a victim by the experience, if that makes sense.
Mm-hmm.
Right? What was the last thing? I don't remember.
You covered them. Yeah, you covered all the tips. Yeah, you're good.
Yeah.
You're good. You did great. You did great. Carolyn, we really appreciate you being on the show. You've made episode 73 one for the books. So thank you for taking the time out. And for folks who don't know, right now for us, it's 5:54 in the morning. So we made sure we had to get this thing in before we had to go out there and tackle the world. But that's what you have to do sometimes. You got to go out there and make that time to do what you want to do so you can do what you can do and want to do after that as well. So I appreciate you making the time.
Oh, I appreciate you having me on. Feel free to welcome me back on any specific topic if you're doing a focused topic on any of the things we talked about.
Absolutely, absolutely. And folks, don't forget the quotation, we are limitless in how deep we can dig to find strength, but sometimes limited by how shallow a crisis can make us feel. Dig deeper. As Carolyn said, you heard her story. She's been through so many things, but no matter what she was given, no matter what she had to go through, she found that strength to dig down deep. And every crisis that she went through, something creative came out of that. Whether she was doing stuff with her kids, whether she was doing stuff in the health realm, sharing meal prep tips with other people, just working out. There were so many things that came out of the crises that she experienced. And we have to do the same. We have to make sure that we keep moving. Like she said, your MD may just say, oh, you have breast cancer? All right, well, let's keep moving. You too have to keep moving and just find that strength, find that goal, find that dig down deep grit that you need to go to the next level. Yes, beast mode, whatever you want to call it, find that and make sure that you too can keep taking your steps to greatness to be the best version of you. Thank you so much for joining us on this show, folks. It's been one for the books. We really appreciate you. And again, follow Be More Today on all of our platforms, whether it be on Instagram, Facebook, and Twitter. Again, my book is on our website, BeMoreToday.com, which you can go to and find my book, our music, our podcast information. And if you want to be a supporter of Be More Today, please go to our site and support or subscribe. We appreciate that. And if you want to send us an email, either to reach out to Carolyn or to myself, email me directly at drshawn@bemoretoday.com. Folks, have a great day, have a great night, have a great life, and continue to take your steps to greatness to be the best version of you. We'll see you next week. Peace.